Let's broadcast. Yeah, I've started the webinar, so now people will start joining. Hi everyone, a very good evening. We'll just wait for a couple of more minutes and let everybody join. We'll start exactly at 5:03. Thank you.
The minutes are always agonizingly long at these kinds of times.
Sorry?
The minutes are always so agonizingly long at these certain points of time.
Yeah. No, we'll start. I think, should we start?
We can wait
And,
till
and
5:03 as you announced.
yeah.
I think that's fine. You let
Numbers
me know
are
if
still
I'm not
increasing.
audible at times.
Yeah, I'll do that. Chandan, we're live, right, on YouTube as well?
Yeah, we are live.
Yep.
Yes. Vikram, we should wait for 2-3 minutes because numbers are still increasing. It will just reach 500 and we can start.
Okay, no, I think we'll start, Chandan, and let others join.
Yeah, 503 is
Yeah.
already.
Yeah. So, very, very good evening to all of you. I'm Vikram. I'm part of the Office of Outreach at Krea University. And I have my colleagues, of course, Dr. Amrita Narayan, who's the speaker for today. And I have my colleague Chirantan, who's with me in the Office of Outreach. And we want to warmly welcome all of you to the 14th lecture actually on the Krea Engage webinar series, where we've had distinguished faculty members, board of management, people from different walks of the Krea University come and talk to all of you. Krea, to those of you who are attending this session for the first time, Krea is a liberal arts and sciences university. We're based very close to Chennai city, in a place called Sri City. It's about 70 kilometers north of Chennai. Krea is actually backed by a stellar team of academicians, industry leaders, intellectuals, and we have probably one of the most eclectic mix of people who support the mission of Krea. And really the mission of the university is to prepare humanity for an unpredictable world. The School of Interwoven Arts and Sciences, which launched in 2013, at SIS, we offer a distinguished undergraduate curriculum in humanities, social sciences, literature, arts, and sciences, taught by distinguished faculty from some of the world's finest academic institutions. Our academic program emphasizes our guiding principles of interwoven learning, something that we've pioneered, which is a multi-directional approach to knowledge that encourages creativity, critical thinking, communication, contemplation, cross-disciplinary approaches, real-world implementation, and the ability to negotiate unanswered questions. Among the majors and minors that the School of Interwoven Arts and Sciences offers, psychology is not only one of the most popular majors, but also in the division of sciences, but also overall one of the most popular majors. And I think in the last few years, there's been an increasing graph of students who are opting for a major in psychology, especially in the liberal arts, liberal universities in India. Careers in psychology, of course, run a gamut from the intensity of clinical practice to the bustle of consulting for an organization, or the rigor and precision of psychological testing. It really is my pleasure to introduce Dr. Amrita Narayan, who's a visiting faculty and a professor for practice for psychology at Krea, as our speaker for this lecture titled, What Can You Do with a Degree in Psychology? To very briefly introduce Dr. Narayan, she's a clinical psychologist and a psychoanalyst with a fondness for literary narrative. Amrita read history and French at Milbury College and earned her doctorate in clinical psychology in 2007 from Stanford University. Following her training as a clinical psychologist, she also trained as a psychoanalyst and is a member of the International Psychoanalytic Organization. Amrita's writing has appeared in academic journals and popular press books. In today's lecture, Amrita will draw from her own career experience to talk about the range of what clinical psychologists do, combining personal weakness with the specific skills necessary for clinical practice. This lecture is sure to spark a few ideas about where a training in psychology can take you. So Amrita, a very, very warm welcome to this lecture.
Thanks, Vikram.
To begin with, I was curious about something in your profile, and that is true of so many of the faculty members at Krea, is that you did not study psychology in your undergrad. So tell us a little bit about how you came to the field, what inspired you to take up psychology post your undergraduation in history and literature.
Yeah. Well, according to me, I've always been in the field. Because the way I looked at history when I was studying it was very much from a psychological vantage point. So if I think back now to my undergraduate thesis in history, I was writing about 1950s advertising and how women were targeted in 1950s advertising. And the work there was very much a psychological perspective, both upon the advertisements, but also what I included were narratives from women who were alive during that time period and on whom these advertisements had a major impact. So it was located in history, but very much a psychological lens. And I think my fondness for psychology and for looking at things psychologically was there right from the beginning. But I studied history and French literature actually, partly because I wasn't very interested in the undergraduate psychology offerings, and I had a very little idea of what one could do with it, especially upon returning to India, which I planned to do. So from my bachelor's, once I got my bachelor's, I was studying abroad in America, and like many people my age at that time period, it's 1998, you have a liberal arts degree, and what can you get but a job in management consulting? And that's what I did. I got a job in management consulting, but as luck would have it, turned out to be a healthcare consulting firm that I was working for. And I was amongst a team of industrial and organizational psychologists. and I was working under them and writing communications for them. And I thought, this is interesting, but also it's not quite it, but it's interesting. And so it started to spark my attention and interest in psychology. At the same time, I had an experience. I was a volunteer teaching yoga at a prison, a women's prison. And this experience of teaching yoga and sort of helping people with the practice of yoga really spoke to me. I was actually very seriously thinking that I will make yoga teaching my full-time occupation. And then something happened in one of my yoga sessions at the prison. One of the students during the Shavasana, the meditation time, she had a panic attack, and she was having a very engaged and verbose conversation with herself. So she had essentially a psychosis that was exacerbated by a panic attack. And it was very, very difficult to be there at that time and to hold the space. But it made me feel that I must do something that could be more useful than being here as a yoga teacher. So I think that moment kind of combined with my interest in narrative and interest in history and in psychology more generally. But that moment just really pushed me into clinical psychology. And so after that, I was looking out for what I could do in the field.
So that's quite interesting. Also, Amrita, I think you've as you said, you've done history and literature. How has it impacted the way you practice as a psychologist? Because your undergrad is in something else. How has it impacted your practice?
I think it's impacted me in a couple of important ways, actually. First, because I came from history and literature, I think I'm much more confident about looking at a range of disciplines and then taking a psychological approach to a range of disciplines. So if you have an interdisciplinary sense in your body, as I did, then I think you feel also more free to apply your particular discipline and play with a different discipline. So I think it gave me more confidence in that regard. Which is, I think, very, very been indispensable to me is that how psychology became in America and pretty much in the world is very, very data driven. And my background in history and literature has helped me keep the stories of psychology, particularly of clinical psychology, alive. And so that interest in stories and narratives, I think it's a kind of a backbone for me. I never worry that I'm going to see people as a number or as a diagnosis. It's not going to happen to me because this interwoven background really gives the narrative, keeps it straight, keeps the narrative important straight. Yeah.
Absolutely, thank you. So just to introduce our audience to you, Amrita, today we have high school students aspiring to become psychologists like you. Some of them, different levels of interest. Of course, some want to do it with other subjects. Some want to deep dive into psychology. There are counselors with us who are in career guidance counseling and psychological counseling. We have educators, principals, parents who are very keen to know from you because I think there is obviously, I think the Indian curriculum and the way it's taught in K-12 space, though it's improving, doesn't give a very holistic approach of subjects to students and doesn't give a bit of clarity. So I think all of them are looking forward to this dialogue from you. So over to you. And just for our audience, that this will be now a session by Professor Amrita, post which we will take questions. So you are requested to put in your questions whenever they come to you in the Q&A section, and we'll take them post the session. Yeah, thank you so much, and over to you, Amrita.
Thanks, Vikram. So the topic for today, what can I do with a degree in psychology? What will a degree in psychology do for me? There's actually a very short answer to that question of what you can do with a degree in psychology. And that short answer is that an undergraduate degree in psychology earns you the right to study more psychology. So by itself, the undergraduate degree, you can go on to a career in advertising or business or marketing. But at its heart, the degree in psychology is a gateway to graduate studies in psychology. Now, why do graduate studies in psychology require an undergraduate psychology degree? Not all the graduate schools do. The reason to study undergraduate psychology is twofold. First is it gives you some direction. Psychology is a very vast and very exciting, diverse field. And beginning at the undergraduate level allows you a chance to really see that diversity. Secondly, studying undergraduate psychology sensitizes you to the nuance of psychology. It's particularly important for clinical psychology, but I think transfers over to all the kinds of psychology, because since we're studying the human mind and emotions that power the human mind, we're studying human subjects. And whether you're in research or in practice, or in the clinic or in business, psychology is about dealing with people's minds and emotions, and we can't mess around with that. We can't tinker with people's minds and emotions as we would with a mechanical device or something inert. So for this reason, an undergraduate degree in psychology during your undergraduate years, you don't have the chance to work directly with patients and with other people. This requires graduate training. In fact, you require between 2 to 5 years of graduate training past the undergraduates to become a counselor for 2 years, or 5 years to become a psychologist, a clinical psychologist, or even an organizational psychologist. So psychology undergrad is a gateway to graduate school psychology. And the way I like to explain this is by the analogy of a musical instrument. Psychologists love metaphors and analogies. We use it a lot in our work. So undergraduate psychology is like learning to read music. It's about acquainting yourself with the range also of musical instruments that are available and the context in which those instruments can be played. But mostly it's about learning to read music so that you could imagine what instrument you could choose to play. Now, a graduate level psychologist has already chosen an instrument and he or she is playing that instrument. And they also have a stage, a theater, a context in which they play that instrument. So let me develop this analogy by plugging it a little bit into the realities of a career in psychology, where the building blocks of undergraduate psychology, the study of the mind and of human emotions, are implemented in the real world. Can you give me that slide, Vikram?
Yes, absolutely. I think we are at capacity for the webinar, so all the 503, so all the rest of them would have to, all the rest of them would have to, yeah, is that right?
Yep, perfect. So this slide gives you an idea of the range of possibilities that are available to you in psychology. And as you can see, it is pretty extensive. But whether you go on to research or practice, whether you're an industrial psychologist who works for a corporate, or a clinical psychologist who designs experimental studies, or a clinical psychologist like myself who meets patients, there's a common language to all the specialties within psychology that you can see in this picture graphic. And an undergraduate degree in psychology, it provides you with the preliminaries of that common language. So in other words, undergraduate psychology teaches you how to read, to write, and most importantly, to think in the language of psychology. Now, when I say reading and writing a language, I'm not referring only to terminology. Of course, we learn terminology and concepts, but the kind of reading and writing that we do in psychology is in the service of organizing our minds, of attuning ourselves to human behavior, human experience, and to what motivates human experience. So in this slide, you're going to see a partial list of careers in psychology, but all these psychologists, the different kinds of psychologists, needs to be able to learn to read, write, and speak the language of psychology. And each of them distinctly plays with a different sets of instruments and with a different kind of audience or theater. For example, the forensic psychologist works in court. She provides her reading of another human being in front of a judge based on her interviews with the person in question and based on her forensic assessments and testing. So she may use her assessment, her psychological assessment, to tell the judge that the defendant is not fit to stand trial or not guilty by reason of insanity. Another example would be an educational psychologist. her theater is a school or the college. She uses her instruments, which are learning testing, psychological testing that helps with intelligence testing, to facilitate learning. She can identify whether it is a mood disorder or a specific learning disability that's causing a block to learning. Another example, relationship psychologist. Maybe she doesn't do any testing. She uses herself as an instrument. She provides assessments of patterns in couples based on repeated interviews and meetings with them. And she uses that forum of meeting with the couple to counsel them. All of these different kinds of careers, each of them has a distinct set of instruments, a distinct theater audience, and a common language that is taught in undergraduate psychology. So while we have language in common, these psychologist positions vary in many important ways. One is, and I'm just going to list a few of these ways in which these different trajectories in psychology differ from one another. One is the level of contact with other human beings. So a researcher might have much less contact than a practitioner, for example. A psychotherapist in a clinic gets far more intense contact compared to an organizational psychologist. The other is the kind of contact. Is it an individual contact or a group contact with other people that you get? Again, depends upon the theater, the place in which you're using the instruments of psychology that you have learned. And yet another question is, are there other people there, or is it just you and another person? Is there a further audience to what you're doing in psychology? All this depends on which context you choose. Then there's a level of exposure to human emotions. Now, although psychology always involves in some way the study of human emotions, psychological testing, for example, in which you're trying to assess someone's learning strengths and weaknesses, does not necessarily involve a lot of exposure to intense, what we call affect in psychology, to intense emotions. On the other hand, psychotherapy, of course, does have an exposure to much more intense emotions. And again, it depends on the kind of psychotherapy you choose to do. It depends on your context, whether it's a school, a prison, a hospital, a clinic, or a business. Learning your own bandwidth emotionally and learning what the context will offer up to you in terms of intensity of emotions and level of contact are some of the ways in which you can choose between these different trajectories within psychology. Another important way of choosing between these trajectories is the kind of instruments that are used. Some people find they have a real affinity for doing psychological testing and some of the number crunching and intense research protocols that go along with psychological testing. And other people feel that testing is not really for them. They'd rather be talking to people one-on-one, hearing about their stories. These are different kinds of factors that allow you to know where you might go in graduate psychology. You could move the slide down, Vikram. Thanks. So to reiterate, the gateway job of an undergraduate degree in psychology is twofold. It's to attune you to the delicate nature of the field, the subtle and sensitive nature of the human mind, and to open you up to the range of career possibilities. Once you learn how to read and think in the language of psychology, that's when you really have the capacity to look at the graduate school options, to look at all those different career options within psychology that I posted on that slide, and choose a context and an instrument that matches to you. Now, what an undergraduate degree can do for you is to help you choose that context, choose the instruments that you like. And how does an undergraduate experience do that? A good undergraduate psychology program uses a combination of content and process to deliver to you this understanding. So just to clarify, content is what you learn, process is how you learn. And when content is just given to you for the most part, process is the interface between the content, your personality, your learning style, the discussions and interactions you have with your colleagues and with the professor. So if you go to graduate studies in psychology, most of the content that you're studying as an undergrad is going to be repeated. But the process that you're getting as an undergrad gives you a leg up in graduate school. This process is very critical to help you make the right choices within the graduate forum of possibilities. So what kinds of content and process questions does an undergraduate psychology degree explore? Of course, we can't go over them all. There are a myriad of them, but a sample of content examples. How to read research, including research statistics. How to understand whether a particular psychology study is valid. Does it measure what it says it's measuring? How to understand the researcher's formulation of their research question. How to read for biases in the way that the research question has been formulated. How to gauge whether the sample size is sufficient to say what they say they're saying at the end of the research study. How to formulate your own research questions. Those are some of the kinds of content variables that we have in a psychology curriculum. So here I want to add something that perhaps it's particular to clinical psychology, but it applies to most of the other branches of psychology as well. And which is that clinical psychology empirical research tells us that it's not enough to only read research. So even though the main content is deliverable in undergraduate psychology is reading research, how to read research, which is quite a process, the process of learning curve, learning how to read research. We can't only do that, particularly so for clinical psychology, arguably for the other psychologies as well. In 2019, the American Psychological Association, they brought forward a task force on evidence-based psychotherapy. And one of the very, very important outcomes that they found is that a better relationship between a therapist and a patient leads to a better outcome. And the most demonstrably effective method to have a better therapeutic outcome and a better relationship between a therapist and a patient is the quality of empathy and the shared empathic space that creates a working alliance between the psychologist and the patient. So for clinical psychology, which is my specialty within psychology, you also need to deepen your capacities for empathy and self-awareness. Now, how does undergraduate psychology help you build your empathy and psychological awareness? Because we don't meet patients, this is where an interwoven approach really helps. Other disciplines and their narratives can broaden our understanding of an experience. So I can read a lot about attention problems, but how do I get a feel for what it actually feels like? Well, I could read somebody's narrative of how they experienced it. My favorite within psychology is, of course, to read literature because I feel that it delivers very much the capacity for empathy. And this has been validated in clinical studies as well. Research tells us that especially reading fiction is linked to empathy and that there are two kinds of empathy that reading fiction helps us with. One is cognitive empathy, which is the capacity to understand the world from another person's point of view. The other is affective empathy, the capacity to feel what they are feeling, to share another person's feelings and emotions. So cognitive empathy, you could get that by reading a lot of data. If you read a lot of data on psychosis, for example, by understanding the various points of experience in psychosis, you could get a feel for the other person's experience, but the feel would be still in your head. Affective empathy, if you read someone's memoir on their bipolar disorder, that would give you a more genuine feeling. It depends also, of course, on your capacity for reading and for feeling. So to know closely a construct like hate or desire, it requires us to be intimate with these constructs. And we become intimate with the constructs, both from a data-driven science perspective and in an interwoven approach, also from a narrative perspective. You foster empathy not only by reading, but also by talking to your classmates, hearing from your professor, recognizing what your blocks are to empathy. So for example, you have a couple of classes on depression and you feel like, well, it's not very interesting. It's not very easy to put myself in the shoes of the other person. Maybe you feel like that's not a very important kind of disorder. Maybe you don't, you feel a bit biased against it. You think depressed people are lazy, for example. It's a popular bias on depression. Um, I don't mean to suggest that an undergraduate degree will remove all your biases, but noticing your biases allows you to decide where to place yourself within the constellation of possibilities in psychology. So if you're noticing that you're not feeling a sense of feeling moved, and empathy, then perhaps that particular area is not the area for you. It could be a content variable, or it could be a process variable. Maybe the professor didn't explain it very well. Maybe you need some film or some narrative device to get you deeper and closer into it. But at any rate, having the experience of empathy or of not empathy during your undergraduate psychology curriculum, that helps kind of create your antenna and make you aware of who you might be as a future psychologist and what kinds of forums in which you would like to practice. So again, you feel no empathy for people who use narcotics. Okay, so then you're not going to go into a substance abuse facility and try to practice there. There's a process of self-awareness and self-discovery. That it's not that we make you write out, how you feel about yourself, and it's not that you're journaling as part of your class, but the process of going through an undergraduate psychology degree is a process of self-discovery. There's no doubt about it. So as you move through different topics and different content variables, you're starting to ask yourself questions. Who am I in this career? Do I belong in this career? But once you're in the undergraduate degree, it's not do I belong, but where do I belong in this career? Which of these instruments is going to be the one that I really feel a click with? So some of the questions you might ask yourself are, do I like hearing about people's experiences? Or do I like helping people but not really listening to their experiences? Am I data-driven or am I feelings-driven? Do I like formulating research questions, or do I like hearing about people's emotional pain and pleasure? Do I like individuals or groups? Am I interested in any special group? Do I like working with elderly people? Am I interested in the end of life? Do I have any particular theme that I want to explore, either as a researcher or a practitioner? It's through an interface with the important themes in psychology, which you get as an undergraduate, that you gain a deeper understanding of what it is that your future tracks as a researcher or a practitioner might be. A lot, of course, depends upon you. You're using your data that we're teaching you, you're using your imagination, and you're using your openness to the experience of others to widen your emotional bandwidth. But of course, you bring your own personality variable into that mix, and it depends very much on how that gels with what is being taught and absorbed. So if I were to summarize, an undergraduate degree in psychology helps you learn the basics of psychology as a language. It helps you learn psychology as a way of thinking. It deploys both content and process to help you find a specialization in psychology. It facilitates your reflective process so that you could think creatively about precisely how to bear upon the field of psychology. And it locates you, it gives you a better sense of who you are. There's one more thing that I want to speak about that applies particularly to mental health. So I get asked this question a lot about the scope of psychology in India, and there's a huge need at the moment for both research and practice in psychology, particularly in clinical psychology and particularly in mental health. There is, of course, a need in social psychology and forensic psychology as well. But the need for clinical psychologists, particularly for mental health workers, is first, we have an acute shortage of mental health workers in India. In 2016, the World Health Organization did a survey, a countrywide survey on psychologists. And in that survey, they've determined that the preferred number of psychologists working in mental health is around 3 for 100,000. The highest number is Argentina. They have 222 psychologists for 100,000. India has 0.75 psychologists for 100,000 people. It's a very low number, and it's an extremely underserved field. That is in the area of practice. In the area of research in psychology, there's another problem. One of the recent studies by a Harvard psychologist, Joseph Heinrich, reminded us that worldwide, the primary producers and consumers of psychological knowledge are a small group of statistical outliers. Heinrich calls them WEIRD. It's an acronym, WEIRD, and the acronym WEIRD stands for Western, Educated, Industrialized, Rich, and Democratic. So the thing about weird people, who are, again, the primary producers and consumers of psychological knowledge, is that they are non-religious, and they have some common traits, such as being individualistic, rejecting religion, believing in free will, and believing in personal responsibility. India does not fall into the psychological categories implied by WEIRD. So even though India's first psychoanalyst, Calcutta-based Girindra Sekhar Bose, was a contemporary of Freud, he had long correspondence with Sigmund Freud, even though the first psychoanalytic society in India opened at the same time as that in Europe, historically, India has not nurtured clinical psychologists. Now, why is that? There are a couple of reasons that we've hypothesized, psychologists have hypothesized, that India has not given a firm footing to clinical psychology until the present. One is that modernity, which is defined in psychology as the willingness to accept that one is an individual, the willingness to accept one's personal responsibility.
I think your mic is disconnected.
Yeah,
is that okay? Okay. Yeah.
How's that now? Is that okay?
Yeah. Yeah, I think.
Sorry about that. So the reasons why psychologists have not been nurtured in India until this point in time. One is that the arrival of psychology and clinical psychology specifically, and psychotherapy more particularly, is very much congruent with the arrival of what we call modernity. And we define modernity as the idea that I'm an individual operating alone by myself. There are no outside forces, no gods, no religious consolation to comfort me. And I am responsible for my life. That idea has been a little bit slower to come in India. Modernity in India has not erased antiquity, it just joined it. So it's very typical in our country that a new way of thinking arises and it just joins the other ways of thinking, and they all exist together at the same time. So Indian families have not been quick to nuclearize, and Indians have not been quick to give up religious consolation. They don't feel that religion and science are so separate. I could still do my puja in the morning and go to work as a chemist. It doesn't contradict who I am. So that is one of the reasons. And because of this reason and the tendency to preserve antiquity alongside modernity, historically Indians have chosen gurus and religious texts, myths, religious stories that are religious or literary stories, but ancient ones that feel supportive and containing to the human experience. Those have taken the place of where clinical psychology might have been. Aside from this reason, there's a second reason, which is that empirical studies, including those among college students, undergrads, tell us that for Indians, keeping a space for the values of an older generation is very important. Indians feel I am and we are equally important. So both the researcher and the practitioner in India have a task in forging the way ahead to manage to research, think, and practice in clinical and social psychology with this idea of psychiatric pluralism in mind. And so the idea of psychiatric pluralism means that you're utilizing one mental health treatment or method, and sometimes you're mixing it with another method that doesn't have a scientific basis, possibly, but it has a cultural meaning. And there are some initial studies by the World Health Organization that one of the reasons that India has had a long-term better outcomes for severe psychotic disorders is that cultural meanings are given to severe psychoses, have been given at least in the past to severe psychoses in India. And those have provided not a cure, but some sense of feeling belonging nevertheless, despite having a very major mental illness.
So there's a very acute and present task in India in psychology right now, both in terms of needing practitioners and so many underserved populations who need mental health practitioners, and in terms of translating the very weird research into meaningful research for the context of our country, in which certain variables defy the ideas of individualism and the rejection of religious consolation that is so common to the West. So I want to conclude saying that psychology needs you. Just because psychology needs you, of course, does not mean it's a match. It's only a match if you like the flavor of it. But even if you're not interested in a future in psychology, there's almost no field, I believe, that includes people but excludes psychology. So, what I want to encourage you to do on this final note is to have a taste. Thank you.
Thank you so much, Amrita. That was extremely enlightening. I think I've learned so much about the field today, even though I've been in Krea for so long. And we'll have to talk more, but I think that let's get into questions. I think one of the first things that I could gauge from you, Amrita, is that, and this is, I think, sort of, I'm coming from the perspective of parents and counselors, and then, and people who are looking, who are sort of decision makers for students, their education. How do students and parents decide whether, are there any particular traits, like you said, like you said, psychologists have been non-religious. So are there things that people could pick up to sort of direct themselves, saying, okay, this is, maybe I am meant to become a psychologist? Are there traits that graduates can pick up?
I would say that if you feel a pull towards the field, if you feel an affinity to the field, to start to read and listen and look and see what matches and resonances are there. I don't think that there's any one trait that defines who a psychologist is. Of course, to have an interest in how the human mind works, how emotions work, and also possibly to have an interest in being close to people. Those are common to most psychologists, but I still would say that to have a taste.
No, but skills like, as you said, empathy or observation, I
Yeah.
think those might be some things that
Yeah.
sort of are prerequisites for you to become.
I don't want to say they're prerequisites, even though I agree that they are important. Empathy, an interest in matching science as well as scientific data, as well as stories and narrative. Um, I don't want to say they're prerequisites because I think suggesting they're prerequisites are saying that they're already innate in the person. I think they can be drawn out. I think that a career education in psychology can bring those out of you, and you'll only know that if you try a little bit. So.
Sure, sure. Thank you. Another popular question that we do get is, I mean, at Krea, psychology belongs to the division of sciences. I mean, we don't have departments, but divisions, and psychology is in the division of sciences. But world over, I think universities are sort of, some put it under the humanities and social sciences, and some put under the sciences. And of course, at this point, I do want to tell all the students that at Krea, we have no prerequisites. I mean, as Amrita said, we don't judge you for the decisions that you've taken when you were 15, 16. But what do you think of this divide, and what is the right way? I mean, I'm sure there's no right way, but what is your opinion on this?
Yeah. Yeah, the divide has quite a history to it. And so, particularly clinical psychology, which is my specialty, has really struggled with at once wanting to be attuned to the more human qualities of the psychological encounter and yet wanting to be accepted as a science. And really, I think a good psychologist is both. He or she is a human being in the room with you, and he or she reads the data of science, but they don't treat you like a data of science. So I think a marriage between the humanistic and the scientific is what makes actually an ideal psychologist. We had to locate it somewhere, so it's located in the sciences at Krea, I think where we're coming from is wanting to have a mix between a scientific and humanistic approach to psychology.
So, Um, I think one of the other questions, and you did mention this quite strongly, that the need for psychologists in India. But I think the underlying worry for a lot of parents is that they don't see, like we always had safe careers, careers like engineering and medicine, where that, okay, you will get a job at the end of the tunnel,
Yeah.
versus when you look at somebody who's doing an undergraduation in psychology. Do you see a lot of opportunities available for them as a student of psychology post their undergrad? Or do you think that a master sort of is a requirement for people to get into either practice or research? I know there are a lot of research vacancies across the country, but what about like jobs and careers in
Yeah.
this?
Yeah. It's an important question. You can't do much with a BA or BSc in psychology. Certainly, you can't do much in the field. You can only study more. But once you become a psychologist, I think of it as a very secure job. Actually, I think there's always a job for a psychologist. There's so much need and there's so much demand across the country, and in every milieu, whether it's in the court system or whether it's in the school system, or whether it's in the clinics and hospitals, there's a huge shortage of psychologists. So I think it's actually a very safe job if you go to graduate school and you become a psychologist, or even a counselor to a great extent. Undergraduate, if you just study a BSc in psychology, or a BA in psychology, advertising or marketing will take you, and you'd probably be pretty useful there because you can give this psychological perspective. You can also use it, if you're a writer or a literary person, you can use it in the way you write. But I wouldn't describe that as a sort of a safe career option. To have a safe career option in psychology, you have to study past the undergraduate level. It's necessary.
Sure. Yeah. And just to also add to this, I mean, in liberal, you've studied in a liberal university. I think there is so much more that you can do with your degree, and the kind of options that are available for students. So I think this was also one of the popular questions that came up, saying, what is a minor? What is a popular minor that I can choose? I think a lot of students want to go into the cognitive sciences, so they're looking at biology, psychology. Some are looking at biology literature. So, like, if you can throw some light on what are more popular minor combinations, and what are some of the more in demand minors that can go well with psychology.
You know, as I've been trying to say, that when you're practicing as a psychologist, you're using an instrument, and so when you choose a minor, also I think really depends on you and what it is that you'd like to do with psychology. So literature is a popular minor, biology is a popular minor, computer science is a popular minor. It depends on how you imagine yourself. You're entering into a field that has a vast array of opportunities and a vast way in which psychology can be utilized. So, whatever minor you choose, it'll be up to you to parlay it, to make it into something that's useful in the field. If you want to be a clinical psychologist, if you want to practice, see patients in hospital, or in your clinic, I would recommend literature or sociology as minors. But if you want to do other things with psychology, if you want to be a research psychologist who's very much focused on the brain, then biology might be a really great combination for you. If you want to be a psychologist who works with criminals and you want to be in the court system, you might choose political science as your minor. It just depends on you and what you imagine yourself doing with this psychology. So I really encourage students to think a little bit about what they imagine themselves doing, how they visualize themselves.
Yeah, yeah. I think that was one of the very popular combinations. Many want to go into criminal psychology. I don't know what's the motive, and I think we should find out, because when so many questions on criminal psychology. But yeah, I
Better to
think
study it than do it, I guess.
absolutely. And this is the next question, actually, Amrita, and I want you to spend some time on this. I think we obviously are heading towards a more and more unpredictable world. Everything that we know is changing so rapidly. This fourth industrial revolution that's coming in. The technological advancements are happening at a pace that they never did before. jobs of the future are changing. I mean, the World Economic Forum says that by 2030, 85% of the jobs that would exist haven't been invented as yet. So where are we heading, and what is the impact of technologies like machine learning, like artificial intelligence, on the field of psychology? And what would you say on this?
Let's take those two questions separately. Where are we heading? I don't know. But I do know that studying psychology is definitely a very good way of learning how to cope with uncertainty, of having a more robust sense of self that allows you to adapt to changing circumstances. Yes. As far as artificial intelligence and the use of electronic medium, for example, in doing psychology, there's more and more applications now that you can get. Instead of having a psychotherapy session once a week, you can get WhatsApp messages throughout the day from an AI built robot that just sends you encouraging messages through the day. It might work for some people. I return to my idea of psychiatric pluralism, that different strokes for different folks, and sometimes there's a click, and sometimes there isn't. When it comes to thinking about meaning and your search for meaning, I'm not sure that artificial intelligence could replace human contact. A big reason why people find their way to clinical psychology clinics and hospitals is because they're having difficulty in relationships, difficulty being close with other people in their lives. It's not yet clear how something like an artificial intelligence forum could help people with that. It might hinder that, in fact. But it remains an unknown, I think.
Sure, I think that's a great answer. Also, this whole thing about ethics. I mean, ethics certainly is an important part of everything that we do. In psychology, I'm sure ethics is something that is held in a very high regard, and especially when we are talking about technology that can disrupt, that can change behaviors, that can lead to changes in the way we live. Social media, you see all that's going around, and a lot of it is actually good, because there is conversation on mental health, especially in India. In the last 1 year, we've seen so much that is work that's happening. So do you think that's enough, or do you think like most of what you read is actually not right on social media? Like, what is your opinion on the use of ethics in the field of psychology?
You mean whether it's ethical to use social media?
No, like how technology is now using maybe psychology into technologies to change behaviors, and what is the role of ethics there?
Well, they should have had him. I mean, this actually picks up from my undergraduate dissertation topic, which was on how clinical psychologists who were trained in the clinic then went to corporates and started selling what they knew about human behavior, selling studies to corporates so that corporates could use their studies to sell products. And I think very much the same question is being raised on social media. I think they should source them ethics.
Yeah, I
Says
think
Gandhi said about Western civilization. I think it's a good idea.
No, absolutely. I mean, when you see the dark web, and when you see all the practices, even the bigger companies now, the way they influence people, I think that's really something that I think we should all talk about.
They
But
gain
going to the
access to the databases of studies that allow them to have that influence. It's very dark.
Absolutely. The next question is really about the mental health, and the stigma that is related around mental health. Is there enough work that is happening now to make people comfortable with mental health being treated as any other disease? And how does that stigma impact on people coming out to clinical psychologists like you? Is that changing? Is that something that is changing now?
I see a huge change actually. It's not enough, but I see a huge change. So let me speak about that first because it's very hopeful. A lot of people that I see who are in their 20s, a lot of people in their 20s coming in for psychotherapy and feeling like this is normal. They analogize it very frequently. The analogy that comes up is to a gym, that if I want to feel better physically, I work out, and if I want to feel better mentally, I come for psychotherapy. So there's certainly, at least in some groups of people, younger people, a big shift. But of course, my sample is extremely small, and people of all ages might require psychological care. So I think there's tons of work to be done. And I think that's where the students come in actually to destigmatize it. I mean, why is it that a country like Argentina has 222 psychologists for 100,000 and we have 0.75? Well, one of the reasons is that Argentina made it really fine to go to a psychologist. It was in some groups almost cool, but at the very least, it was not a big deal. It was a normal thing to do. As for your mind and heart, similarly, what you do for your body, you go to a doctor, you do the same thing. And if we could have such a movement in our country to just really normalize it, I think that would be, I think it's underway, but I think it would be splendid to accelerate that movement by all of us participating in it, by talking about it, and by saying that, throwing it into the conversation without giving it so much gravitas and shame, which seems to be so dominant when talking about therapy.
Thank you. And really, the last point that I've come in, and then we quickly start taking questions as a rapid fire because I see 177 questions. Yeah. So just talk a little bit about the psychology program at Krea. And since you've studied psychology at Stanford, what direction or what sort of, I mean, I know we have the interwoven learning model and all the majors and minors at Krea follow the interwoven learning model, but if you can spend maybe 2-3 minutes on the program at Krea.
Hmm. I guess I already spoke about it a little bit, but it's just to keep a balance between the science and data-driven part and the more humanistic approach to psychology, and to give students an exposure to both of these in any particular psychology class that we offer. And to very much encourage discussions that come from interdisciplinary perspectives within the scope of the psychology class, and for students to slowly, I think it's a growing awareness, for students to have the growing awareness that this is also psychology, and not to feel other disciplines as interlopers to psychology, but rather just to see how we can dialogue between disciplines using psychology and the human mind and emotions as our currency of dialogue.
Sure. Um, Amita, there are multiple questions about the field of industrial psychology. Is that something that you would want to take up and spend some time on?
Well, get ready to study some more, is what I have to say. Industrial psychology, it's usually a 5-year course that follows from your bachelor's in psychology, and you then get to work as a management consultant, for example, or in a range of settings for industry as a corporate consultant, helping transition people in mergers and acquisitions. Groups in corporations behave in certain ways. And if you're trained as an industrial organizational psychologist, you can help shape the group behavior. You can help the corporation have a smooth transition or smooth layoffs, as the case may be. That's about all I can say about it. It's pretty general because I didn't go into that's not my specialty. But it's an interesting way to work with corporations and with group behavior. So, yeah.
Yeah, thank you. The next question is, could you explain the difference of being a psychologist from a psychiatrist? How does one go about it?
Psychiatrist has an MD and prescribes medicines, usually meets with people for around 15-20 minutes of time, gives them or changes their medicine, and that's what the psychiatrist does. A psychologist does not prescribe medication, does not have an MD, may have a PsyD, which I do, or a PhD in clinical psychology, and meets with people 1 hour at a time over time. They're typically called psychotherapy sessions, and 20 plus or so sessions at the very least, at the very minimum, make up a treatment. So they're dealing with two different currencies, essentially. The psychiatrist's currency is the medication. The psychologist's currency is what we call the talking cure. As far as treatment goes, psychologists also do ranges of other things like testing and so forth, as I described earlier. But that's the definition of psychiatrist versus psychologist.
Thank you. The next question is, I just read the entire thing. So it says, if I take psychology and literature combination, say as a major and a minor, and I continue in the fourth year and convert my minor into a major, what opportunities would open up both in terms of post-graduation courses abroad and well-paying career prospects?
Is that, I didn't catch the last part. So they're going to convert the literature also to a major, do a double major essentially?
Yes, something like that. And what kind of opportunities would open up for postgraduate studies and for career opportunities?
Well, what kind of opportunities do you want to open up for yourself? I guess I would return. I mean, I think it's a splendid combination, and I think it's a lovely double major to have psychology and literature together. What can you do with it? If you want to practice as a psychologist, as I said, you have to study some more. But if you're the combination of psychology and literature working together, it allows you to be a literary critic. That's the word I was looking for. It allows you to be a literary critic in a very particular way. So you and I could both read a novel and you come up with the plot of it, but I could give a psychological reading of it that would be very different from it. But if I was well versed in psychology and in literature, I'd be able to get you to see it as I see it. So I think the strength of having a psychology and literature degree together is it allows you to read books from a psychological lens and present that to other people. My guess is that you would have to do, even if you're doing just that, if you weren't studying any psychology, you'd have to go to graduate school, study it some more, and then you could write books and teach and have a very well-paid career after you studied some more.
Sure, thank you. The next question is, what therapies can be integrated with the practice of health psychology?
I'm not a health psychologist, so but I think many of the traditional therapies like yoga, Ayurveda, medicine, meditation are typically integrated by health psychologists. Also, mindfulness-based stress reduction. So I think that's a typical group that is used by health psychologists. I guess yoga, mindfulness, and mindfulness-based stress reduction first, and then in some cases, if the person's open to it, Ayurveda as well.
I think there's another question which says that, if somebody is interested to become a clinical psychologist, just like you, what would you suggest them? Because I think there are courses in clinical psychology in undergrad as well. So would it be better for somebody to take psychology as a whole, as a major in their graduate school? And then sort of when they're doing in the undergrad program and then do clinical psychology at graduate school, does that work, or would you suggest somebody to take clinical psychology from the undergrad?
Well, I didn't take clinical psychology in undergrad, as I've said, and I think it does open up a lot to not take it. But a lot of graduate schools, especially in India, still require you to take an undergrad in clinical psychology. Not all of them, but many of them do. So in the sense of as a preparation for graduate school, as I said before during my talk, content-wise, they will repeat everything that you would learn as an undergraduate. So in terms of content, you're not going to get something that you won't get in graduate school. But in terms of getting to understand what graduate program might work for you, what your practice content or research context would be, I think it's useful. The undergrad in psychology is useful, but not compulsory.
Sure. And what about, I think the next question is, what is the condition of research psychologists in India? I think that I'd actually increase the scope of the question a little bit. Like when you compare to the Western world, you've been in the US, how do we compare in terms of research and opportunities and environments and support that is available?
I'm not sure. I'm not a research psychologist myself. I know that things are burgeoning, that it's a very good time to be a clinical psychologist, even a research psychologist, and that the finances and funding, rather, and opportunities are on the rise. No doubt about that. Is it comparable to the West? Not sure. I'm not sure if we want to compare it to the West right now, because actually the West is going through a real crunch in terms of funding for research in clinical psychology at the moment. But that's about all I can say about it, not being a researcher myself.
So, yeah, and feel free to just tell us if you would like to not take the question. I think that's fine as well. So the next question is actually from Samali. She says, I have been an economics undergraduate degree. Is there any way I can get into the world of studying psychology? That's the first question. And the second question is, does a BA degree in psychology allow me to practice clinical? I think that you've already answered. And prescribe medications. I think that second one you've already answered. But would, if you want to take that up, yeah.
Yeah, BA degree in psychology doesn't allow you to do anything except go study more psychology. It gives you the right to study more psychology. You cannot prescribe medication. You cannot practice psychotherapy. You cannot do any counseling. You must not do any counseling. The other question.
The other question, sorry, I've just scrolled. There's a BA
Economics, yes.
economics undergrad, yeah.
I think certainly, I think that would be a very interesting crossover to make. And you'd have to find the right graduate school. If you go to America or Europe, it's probably not a problem. You'll probably have to take one or two online psychology courses in order to compensate. Usually they ask you to take intro to psychology and intro to statistical and research methods, just two classes. And after that, you can apply. And as long as you make your case, as I said, they revise most of what is taught in undergrad, again in graduate school. It's only certain institutions in India that are a little bit old school, shall we say, that won't allow you to join and that require you to have an undergrad in psychology.
Sure. The next question is from Gurleen Kaur. She says, I think she's a career counselor. She says, how instrumental is psychology in career counseling? And is career counseling a further branch, or is it one of the things that you can specialize in the field of psychology itself?
Okay. I don't think it's considered a part of psychology, but I'm not really sure.
Okay. The next question is from Rupali. She says, I want to be an adolescent psychologist. At present, I'm a JEE main aspirant, so that's engineering. My parents were like, you can opt psychology when you are doing your MSc in the US. Will this help me, Amit, will right path? I think what she's trying to say is that her parents are pushing her to do engineering, and then they're like, the student can do an MSc in psychology post the engineering program, and she would like your views on that.
Whether you can do an MSc in psychology after engineering, I mean, why not? You'd have to find the right institution that would accept you and find out. They'll probably, again, as I said, make you do one or two prerequisite psychology classes that you could complete, online or in a college nearby to you. And then, yes.
Yeah. The next question is, and the person who's written it says it's quite specific. But do you know personally how any empathy or highly sensitive people who are psychologists, and how do you think someone like that could cope up with a mentally heavy, draining field like psychology, especially when so many empathy find calling in healing fields?
Yeah.
I'm sorry, that was.
Yeah. It's a great question, actually. And it's actually a common one that people ask psychologists, that A, is it draining, and B, what is it like to be a sensitive person who works in psychology? Um, if you're well trained, then yes, it's draining at times, but it's also very, very pleasurable at times, because the idea is not that you only share a person's sorrow and heaviness, but also their celebrations and pleasures. And you get to be a part of someone's life in an important way. To the second question, if you're a very sensitive person, and you're listening to people's stories all day in the psychotherapy clinic, yes, it could be very difficult for you. And I would encourage you to think about other options in psychology. Maybe you want to do some testing, and only 2 hours a day of listening to someone. If you find yourself sensitive or porous when in the field of emotion, then maybe sitting with another person and listening to them is not the right choice for you. But there are many other options in psychology. Maybe you want to do research in which you can think about the emotions, you can listen to recordings of people speaking about their emotions, but not actually have to subject yourself to that. And thereby you could protect your sensitivity.
Sure, thank you. The next question is a student is specifically asking about the kind of subjects that an undergraduate study in psychology would have, and especially are there required courses and are there electives that are offered? So, what kind of subjects would a student have within the major or minor of psychology in any university?
Mm. Well, what you have in every university is an introduction to psychology that talks about attention, perception, how we use our senses to formulate emotional data, motivation, these sort of basic concepts that are considered to be human universals. And that's an intro to psychology course that is offered at all universities. So that is usually compulsory for graduate studies. And usually research methods, one class, one unit of research method is also compulsory. Now, if you're going on a very extremely research track of psychology for your graduate school, you might need to take more than one research methods class. So typically how it's organized, because I think that's the question, is that you start with an intro and some research methods, and then you have a whole bunch of electives. So maybe child psychology is one of your electives. I offered last semester psychology of gender and sexuality, maybe psychology of substance abuse. There could be numerous possibilities for electives, and that just depends on your college and what your professors are interested in offering to teach. So that's generally how it goes.
Thank you. The next question is from Raman. He says, it would be interesting if you could share more about how one can explore the relationship between yoga and psychotherapy for research as well as practice.
Oh gosh, I did my doctoral dissertation on this. I don't think I can say very much about it. I think it's a fantastic tool to be used. I think figuring out the main challenge with interface between yoga and psychology is figuring out, how you're going to dispense the treatment. So for psychotherapy, I'm very clear. I have like a couple of chairs and a couch, and someone comes here and they sit and talk to me. With yoga, if the person is doing asanas, for example, with the same person with whom they have psychotherapy with, it's sort of a sticky ground, and I haven't gone there myself. There's lots and lots of anecdotal evidence from in both directions, one that says that it's great and the other that says that it's harmful. But what we do know, what has been sort of well researched and that does work empirically, is that for someone to get psychotherapy treatment and then separately with somebody else have mindfulness-based stress reduction or yoga alongside psychotherapy. So generally that's the method that's found most useful.
Sure.
Together
Yeah.
but not mixed.
The next question is from Srinidhi Mahishi. She says, how is mental health connected to physical health? I have read about diverse gut microbiomes, which are indicators of mental health and are also correlated with physical health. Okay, do we go to the next question?
Yeah, let's go to the next question.
Okay. What are some of the good books to read for a psychology student? I think that's interesting. Do you have any books to recommend for beginners in psychology?
First of all, I really recommend reading literature as a prelude to studying psychology. One of my favorite texts, and the one that I read before I started studying psychology myself, is a book called Family Evaluation, and it's by Dr. Murray Bowen. It's a thick text that you can find, but it's very, very readable. And it locates the individual in the context of their family and explains how psychological symptoms arise as a constellation of family dynamics. So that's a book that I would recommend.
Okay. The next one seems like a comment and not a question. So it says, not all psychologists are non-religious. Indeed, counseling uses therapies involving focus on clients' values. Also, spiritual counseling is one of the prominent therapies used based on client issues and concerns.
Yeah, absolutely. I don't disagree at all. What I was trying to say was not that psychologists are non-religious, not at all. What I was trying to say, this was in the context of an earlier discussion as part of my presentation about why psychologists haven't been strongly relied upon in India. And I contextualize that in the history of psychology and psychotherapy, particularly, which is linked to giving up the priest and seeing the psychotherapist instead. And that is actually a very Western model. And in fact, I said quite the opposite at the end of my talk, that I think that we should be prepared to work alongside that. And as this person correctly says, there's also pastoral counseling that's specifically spiritual counseling, for example, but not clinical psychology. Pastoral counseling or spiritual counseling is not widely accepted within clinical psychology. It is just that in the history of clinical psychology that religion has not been prominent, not that it's still not existing.
Yeah, thank you. I think we are at the end of time, but if you allow, we'll take just one last question. It says, so the question is from an anonymous person. He says, when you talk of psychology as a field, many people do not see it as a science. And there seem to be many cynics about the possibility of psychology healing people in the workspaces. Are you discriminated for not being a real science?
I have given up the wish to be accepted by
Accepted.
the scientist probably around 10 years ago. But no, I don't find it to be a problem at this stage in my career. I do think I cared about it much more 10 years ago, maybe, or 20 years ago. And at that point, perhaps I felt it more also. But I think things have changed a lot in this respect. There is a lot of empirical data about the effectiveness of psychotherapy, and there are comparisons between psychotherapy and drugs for particular conditions like a depression and anxiety, and psychotherapy comes out equal to drugs in many of these trials. And the trials have been reliably reproduced over time, which is, the hallmark of science, is that the results should be generalizable, the results should be reliably reproduced over time. So I think things have really changed, and there's quite a body of scientific research at this point. So the perspective has also changed.
Sure, thank you. I think that's been wonderful, very, very informative, a lot of content to process, I think, for young students, and lots to think about to everyone. So thank you so much for being so wonderful and being here with us and making the time to be available in your busy schedule. Any parting thoughts, Professor?
You're most welcome, Vikram, and I was glad to be here. My parting thought is have a taste. Have a taste of psychology, because I think that if the flavor appeals to you, if you find a match, it's such a rich field that can keep you fulfilled if there's a match for the rest of your life. I just think it's a very deep and enriching field. So have a taste.
Thank you. With that note, I really would like to thank all our audiences for being so patient and asking 285 questions to be precise. Thank you so much for being a part of this. I think we will continue to bring people from Krea to talk about various things and disciplines. To all of you who are studying in the grade 12th, applications to the undergraduate program at Krea are open. We're currently in the second round, the deadline for which is 23rd of January. In case you wish to reach any of us, you could write to ask at Krea at edu, krea.edu.in. Thank you so much and have a wonderful day. Thank you.